and you think that everybody in the family is handicapped, then you suddenly realise that it isn't everybody in the family that's handicapped. It's your baby that's handicapped, and they're going to be handicapped for the rest of their lives.
Pull it up and then drop it behind.
It's hot again, Dad.
So parents, doctors, teachers, all of us need to make a special effort to give these children the care, the training, and above all, the extra attention and love which will give them the hope, confidence, and as much independence as they can achieve.
What else is in there apart from sugar beets?
I don't know.
John Robinson is blind. He will never see as we see, but his parents, by guiding him to develop the other senses, can help him to understand our world.
When he was about 5, we've been bringing him to farm so that he can see sheep, he can touch lambs, he can get right down to grips with the animals and really find out what they smell like and what they feel like, and find that they eat food, what sort of food they like, the sort of noise they make. And this way he finds out about animals in his own way, which isn't the way that we know them, but is a way that is very much real to John. And this is the only way we can do it.
Now he's stroking it.
Yes, Dad, does it like it now?
All you have to do is to take the blind person to the sheep, let him touch it.
It feels like a blanket.
It does, doesn't it?
Yeah,
And then the
why?
blind person gets an idea what a sheep is.
Wool and the
Wool.
lamb
Where does wool come from?
sheep and lamb.
That's right.
We feel that after we've been at the farm, when John mentions animals, or I've seen a pig, I've seen a cow, I've seen a lamb, we feel that he isn't just copying the word see, which can happen quite a lot with blind children. They don't want to be different from other children. They use the vocabulary of sighted children. And we feel that when John says, I've seen a pig, I've seen a cow, we know exactly what he means. He means he's got to grips, he's touched it, he's smelled it, he's cuddled it, he's felt all about it. He's felt its three-dimensional shape.
Shelley Benbow has no eyes. For her too, it's by touching things that she can learn best.
We had a funny incident at the doctor's the other week. She was sitting on my knee, and the lady next to me had a fur coat on. And Shelley was feeling, and she touched this coat, and she turned around and said, "Oh, the lady's wearing a pussycat," which could have been very embarrassing, but fortunately the lady laughed with us instead of getting a bit annoyed, which is something that could really happen. It's a reaction. People don't realise that Shelley's got to use her hands for her eyes. And if people could just get over their initial embarrassment, because that's what it is, they don't realise how much they would be helping her, as well as helping me.
But those of us who can see, who do not live with this problem, can too easily be thoughtless and cause pain.
Well, when she was a baby, the main problem was that people used to look at her, and the first thing that came into their minds, like, is she asleep? She was sitting up in the pram talking, and I used to get a bit cross and a bit upset because obviously she wasn't asleep. And then you have to explain to them that she was blind, she had no eyes. That was difficult, especially with her sitting there. I tend to treat Shelley as normal because I don't have any other children to compare her with. It's not until we see friends and their children and I realise what she isn't doing that she should be doing, that's when it really comes home to you. That's when you really realise that she's got her limitations, and she always will have.
Shelley now goes to a special school for blind children 3 days a week. For her mother, this helps to overcome another difficulty.
I think Shelley could have done a lot more if I hadn't have been so protective. I think it's a natural instinct to protect them, although you've got to stand back and watch them take the falls. This is why school is so much better. Although she gets lots of love and attention, they aren't emotionally involved to the same degree as I am or as my husband is. And it's really just a case of standing back and hoping that she doesn't get hurt too much while she's learning about life.
uncertainty, love and patience. Sarah Delane is partially sighted, but the same problems for her parents too are always present.
I think with anybody having a child with this complaint, you've got to be patient. It takes years rather than months before anyone can tell you exactly what vision, you know, these children have. I mean, we've been told that Sarah would be 3 or 4 years old before she would be able to do a proper eye test. And then that's the time that we would find out Sarah's capabilities.
She seems to be able to cope herself very well with walking around the house and whatnot. Whilst Elaine's doing a housework, obviously she can't really give her the attention that she needs. That's where our Paul comes in. He's pretty helpful in that respect. He seems to look after her. He's very sensible for his age.
Man, that gets to me.
Well, the next step is like a trial period. The last assessment she went to, the people there wanted her to go to a nursery school, didn't they? Yeah. In September, and see how she managed in an environment with other children. Looking forward to the fact that she possibly have to go to either a normal school or a partially sighted school. She's very intelligent and she likes to play with children. I don't think there's going to be any problem at nursery school.
No.
There it says.
Dawn Smallwood, who is 9, has a different handicap. When she was 2 years old, it became clear that she was unable to speak. In many ways, it was a more difficult disability to understand at first, and perhaps does not attract as much immediate sympathy. But it was no less of a problem for her parents and for her.
Right. Very difficult for her because she couldn't make us understand. She'd sort of learn one word, and then when you tried to teach her something else, she'd forgotten what, you know, the first word that she'd learnt. She used to get into terrible frustration with herself, you know, trying to express herself, because it was always a matter of she'd have to try and take you to show you whatever she wanted. Very difficult.
Well, I took her to the clinic, and then the doctor noticed there was something wrong, you know, so she advised us to take her to the Secret Hospital. My husband didn't want to believe there was anything wrong, you know.
I just didn't want to accept that there's anything wrong with Dawn at all. So I asked her to leave it for a while, and then after a while, she eventually got me to go to the doctor with her. Well, that's when we were referred to the hospital, and we went to St. James's Hospital, and various tests were carried out on Dawn to see if they could find anything wrong, a reason for the fact that she wasn't speaking.
So when she was the same age as this little boy, Dawn's parents took her to the Regional Child Development Centre at St. James's University Hospital, Leeds. There, children with various disabilities undergo tests to discover what are their particular problems.
Andrew, I'm just going to look into your ears, all right?
The consultant paediatrician in charge of the unit, Dr. Rasunis, believes this little boy's problem is, like Dawn's, a communications one, a difficulty with speech. But just in case his lack of ability to speak is due to, for example, deafness, he tests Andrew's hearing.
And what is this?
Do.
And what's that?
Ball.
Oh, that's a ball. And what's this?
Go.
Right. Now, Andrew, can you put the ball in the cup?
There.
Can you put the ball in the cup? All right, then. Can you put the spoon in the cup?
Get there.
Jolly good, jolly good. Andrew, can you put the fork in the cup? Put the fork
Andrew's hearing seems to be normal, so Dr. Rasunis asked the psychologist to make an assessment of his intelligence.
And send the train through the bridge to your side. Here it comes. Here it comes through the bridge. Choo-choo-choo. Train's coming through the bridge to your side, isn't it? Can you push it back to my side? Oh.
Andrew, listen.
Then Andrew goes to the speech therapist, who tests his ability to understand the meaning of simple words and sounds and relate them to everyday things. While children are at the centre, experts observe how they communicate with other children through play. Then the centre recommend what type of school is best for each child. Dawn went first to a nursery school with provision for speech therapy. Then she went to Fernville Special School, where the headmistress, Mrs. Carlin, confirms the importance of seeking early expert advice.
Parents who are worried about their children's development should really seek advice as early as possible. If they leave it until the child becomes of statutory school age, then it could be that 5 years have been lost, during which time something could have been done. And I would strongly advise parents who are worried about their children to consult the health visitor. The health visitor is trained to know the normal milestones in development. And if parents will express their worries, then the health visitor should be able to refer them to the appropriate agencies. Under the 1981 Education Act, which actually became law in April 1983, children can be referred to the education department from a very, very early age, and help can be given.
Some children stay at special schools for the whole of their education. Others, who are more able to expand their boundaries, are nowadays able to find places in certain integrated schools, ordinary primary, secondary, middle and high schools, which have special provisions for those who need extra help to keep up with their classmates. But first, these children go through an educational diagnostic unit. Many of them, as you can see, have Dawn's difficulty with words. Mrs. Siddle and her staff have them in their care in order to discover the extent of their particular capabilities.
We carry on the assessment that was started by the psychologist by a variety of tests. We monitor the progress very, very carefully and hope that in conjunction with the school doctor, the advisor, everybody else who's concerned with the children, that we reach the right decision as to which school these children should be eventually placed in.
Now that parents and schools are working together, it's important that the family, naturally anxious to see their child progress as quickly as possible, should recognize the pace which the school discovers is best and adapt themselves to it.
With a lot of the children, we send weekly diaries home where the parents are told what we've been doing, and they're invited to tell us what they have been doing. This gives us a chance to talk to the children about things that have happened to them. And we find that this is very, very valuable. And from that, the parents can get quite involved in what we're doing. These are the children with whom we have most success, where we are all working together. It's got to be a partnership between school and parents.
Now the parents are not so much alone. With the continued expert help the children receive comes further progress.
Well, she was about 4, and a friend of ours bought a book from a jumble sale and gave it to Dawn, and she read the whole book right through, and we thought it was marvelous. And so my husband went out and got the whole series, for her to read. And we were very thrilled about it.
Oh, it was a tremendous surprise. It was a shock to us, wasn't it, that day? Because before there'd been nothing, and then all of a sudden to read a book from start to finish. Marvellous. It really was. We were both thrilled, weren't we?
Yeah. Come along, then.
But there's always anxiety. Will progress continue? For Dawn, the goal was Blenheim Primary School.
Well, it was tremendous when she first went there, wasn't it, love? She was 5 years old, and she'd just managed to get to Blenheim. They felt that she had enough intelligence to be able to cope. And it was a special unit, wasn't it, in an ordinary school, because we'd never dreamed, really, had we, that she'd go to an ordinary school.
We were pleased that she was making so much progress. It was very nice to see it.
Yeah.
She was understanding more, and she was enjoying her work.
She came on in leaps and bounds, didn't she? Everything, behaviour, speech, understanding. And then we heard about Fir Tree Middle School, and eventually she was successful and was able to go to Fir Tree, so that was progress, which was always nice to see. First of all, she was excited to go there, uniform and everything that goes along with it. She wanted this. And in the lessons, of course, she joins in with others, doesn't she? She's not just in the unit all the time, like at Blenheim, but she's in the unit for certain things like speech therapy, the understanding, and also maths.
And treating CHNSDK, Aguru, Crow and Cow.
That's right. And you know why we have two sounds for that one? Because one says the O sound, as in crow, and the other says the ow sound, as in cow. That's right. Now, what's your next lesson, Dawn?
French.
And do you like French? Do you like going to French?
Yes.
What are you doing just now in French?
Think about...
Can you remember?
No.
Can you count up to 10 in French for me?
Yeah.
Go on, then.
1, 2, 3, 4, 5, 6, 7, 10. 7, 8.
9.
9.
Step by step, the long journey to confidence and independence goes on. The same is happening to John Robinson, who's learning to trust the physical strength and agility of his own body at St Vincent's School for the Blind and Partially Sighted.
Just a moment. Keep your head up and go straight forward.
He learns mobility so that he can find his way about the world on his own.
Weekend into your side. Now you just walk towards the wall for me. Stop. Right? See how near to your body that cane is?
Yes.
That's a good boy. Okay, turn around to face me again. All right, and what I want you to do this time, keep your head up, is walk all the way back to the door where we came from. All right? Give me a start. Okay, off you go. Keep that arm out in front of you. That's lovely. Keep on going.
Above all, he's learning to express himself in an educated way, so that he can tell others what his thoughts are by means of writing as well as talking. He's mastered the Brailler, the machine on which he types signs that can be read by others, running the tips of their fingers along the dots that John has punched in the paper. Of course, every child needs all the love, care and attention their family and those who teach them can give. But children who are handicapped have very special needs. They must be given the extra help to achieve the confidence, opportunity and independence to which they also are entitled.
Children with special needs can't progress at the same rate as children who have not had these problems. But their needs can be met if we're all prepared to make haste slowly.
At Easter, I went to a farm on Wednesday. When we were at the farm, we fed the pigs and we threw the food to them. I could hear them eating it all up. Next, we fed the sheep. We did all of this because we were being filmed. We threw the food to the sheep and we had a look at a lamb. Then we went into the pen and put some food into the trough. And then we went back in because the film had ended. And I liked Wednesday better than all the days in the week put together.